All right. So after we intake a prescription, we'll want to pre-check that prescription. That's one of the parts of workflow, community pharmacy workflow that we'll be practicing throughout the semester, getting better at. So to pre-check a prescription we put in, we're going to click our pre-check, begin. And so now for pre-check, I've got a screenshot from Pioneer. So this is a prescription. Probably may look familiar if you've did the intake on this. This is now, it's been inputted into the system. And so here's the information that got typed into the system. If you have trouble seeing this, you can get a PDF of that a little bit bigger, as well as if you need to see the prescription, again, you can click on that. So that can be helpful to you from just seeing what's going on here. So yeah, the big thing we're doing with pre-check now is just making sure that what was entered into the system is what was on the prescription. So you want to be systematic with this. I tend to, the way that I do it is just kind of start with the patient's name and date of birth. So Shannon Stark, 8/31/64, 8/31/64. So we know we're good there. If we wanted to verify the address, we could take a look at that as well to make sure that we have the right patient, that our system is updated. It is, that all matches. So that is good. Then we have the doctor. The other thing, when you are checking, it's always good to read the prescription for yourself and then check and see what was put into the system. So with the doctor, I'm going to read Harold Barlow, or Howard Barlow, sorry, and then Howard Barlow is the doctor with the correct address that was put in the system. So that is correct information. Then I'm going to look at our date, so 1/7/2022, 1/14. So we've got 1/14/2022. So that this date is incorrect date compared to written. So that is wrong. Also, this is an electronic prescription. We can tell because it has been electronically signed. But we have that the origin has been a walk-in, like somebody brought in a handwritten prescription, walked in and gave it to us. This would be submitted electronically, so this origin is wrong. This should be selected electronic. All right, so we've checked our patient, we've checked our doctor. Those things are correct. We recognize we have a wrong date and our origin is incorrect, so two things wrong. Still need to check chlorthalidone 25 milligram tablets. Chlorthalidone 25 milligram tablets, that's correct. Quantity of 90, quantity of 30. So this was also entered with the wrong quantity in the system, so that's incorrect. Our refills 3 and 3 match. Dispenses written no, so none of that's checked, which is good. This was signed. And then our directions, 1 tablet every morning. So I'm looking, we've got take 1 tablet every morning. That on face value looks correct. However, we do need our route of administration. So take 1 tablet by mouth every morning. So this is inputted incorrect. We need a PO here, which would make a by mouth here. So things that are wrong with this prescription then are our patient's correct, doctor's correct, our date is wrong, origin is wrong, medication is correct, quantity is wrong, refills are correct, and then our SIG is incorrect. So we've actually got 4 things wrong with this. So we come down kind of to our question and say, all right, incorrect patient information, nope. We have correct patient information and correct date written, yes. Incorrect origin, yes. So I'm going to check those. Incorrect quantity, yes. And incorrect directions. Our refills are correct, our provider was correct, and our medication name, strength, dosage form was correct. So, and then what is the day supply for this prescription? And this is going to be off of what was written here. So, patient has taken this 1 time a day, has 90 of them. We put a 90-day supply here and then submit it. So that is how we are going to be pre-checking this semester.